Caring Unveiled with Jarrett Stahl.
Welcome to Caring Unveiled, a quarterly program brought to you by Memorial Health Foundation. This series is our way of connecting with you, our generous supporters, and offering a behind-the-scenes look at the compassionate care being delivered across our region. In each episode, we'll introduce you to the dedicated team members who serve our communities, highlight the life-changing services available close to home, and shine a light on the mission-driven work happening every day at Memorial Health System. Today, we are taking a trip to our Belpre Medical Campus and sitting down with Stacey Wyers, Director of Oncology for Memorial Health System. We are excited to show you, our donors, some behind-the-scenes technology at the Cancer Center and remind you of the services we provide to the community. Stacey, thank you for joining us today.
Thank you for having me.
Let's tell the viewers a little bit about yourself and your role with the Cancer Center.
Okay, so my name's Stacey Wyers. I am the Director of Oncology Services, and I have been with the health system for 23 years as of August, and I've been the Director of Oncology at the Cancer Center now for 4 years.
We are away from the studio today where we normally record this. We're in a very special room in the Cancer Center called the Tumor Board Room. Let's talk about what's in this room and how it's used.
Yes, this is our conference room where all of our physicians come twice a week and we discuss new cancer cases. So patients' cases are discussed, whether it be difficult cases or just ordinary cases that we need to make sure that we're on the right path, make sure that we're helping them throughout their journey, identifying the correct care for, plan of care for them, and just making sure that we're making the best decision for their cancer care.
Tell us a little bit about what people see if they've not been in the Cancer Center.
Wide open halls, a lot of light, a lot of natural light, and just a healing environment for patients and their families. If you've been here, you hear the music in the background. We try to keep low music. Patients tell us that they feel as though they're in a high-end resort, not a cancer center, which is exactly what we were aiming for, that comfort and feel that can help them heal and go on their cancer journey.
And the building even has indoor and outdoor spaces that patients and their caregivers can be indoors and outdoors while they're here. There's a bistro here as well. So it's a really nice facility here in Belpre where all of our Cancer Center is now housed.
Yeah.
Unfortunately, we have a high rate of cancer in our area, and we have a lot of services here to help our patients. Do you want to talk some about the services that patients can receive here?
Yeah. So, the typical services, chemotherapy, radiation treatment, as well as infusion services, hydrations, PICC line insertions, even targeted therapies such as immunotherapy and hormone therapy treatments, just to name a few off the top of my head.
Right. One of the things that always impresses people is down on the first floor with radiation, those large vaults that are there that I know were very specially designed. And that's kind of behind the scenes. Not everyone sees that. Do you want to talk a little bit about what those are, how they were designed, and the importance?
I'd love to. So our radiation vaults were designed at kind of similarly as the whole entire Cancer Center. So we focus more on trying to give a little more space for patients. We also have some illumination around the room and the ceiling. So the patients lay on their backs typically for treatment. So it gives them something to look at up above. It's leaves and waterfalls and different things like that in the ceiling. We're fortunate to have 3 radiation treatment machines now. So each of those vaults have that same environment.
And we're very fortunate to have the CyberKnife here. And we talked a lot about the CyberKnife when we were opening the building because that's the first time we had that. So for our viewers that may not know, you want to explain what the CyberKnife is?
I would love to. So the CyberKnife machine is one of our 3 treatment machines in our radiation oncology department. And the CyberKnife is a very precise radiation treatment delivery machine that delivers the radiation treatment through a robotic arm. Mm-hmm. It has very precise aim at different tumors, cancerous and non-cancerous, so that we're able to deliver high doses of radiation treatment without affecting normal tissue around. Mm-hmm. And we are actually only one of 4 in the whole state of Ohio. And then the closest CyberKnife machine in West Virginia is down in Huntington. So we're very fortunate that the health system was able to do that for us and offer that treatment option for patients.
I know that was one of the most expensive pieces of equipment the health system has ever acquired, but I think that speaks to our commitment at Memorial Health System of keeping care local.
There's research and all kinds of technology that goes into developing new treatment plans for patients to give patients more options for their care. So we are fortunate to partner with the National Cancer Institute community research program. And with our partnership with them, it gives us access to clinical trials nationwide. And I like that you mentioned that we can provide our care here in the Mid-Ohio Valley, because a lot of patients don't know that. And we can offer that state-of-the-art care that's available nationwide right here in the Mid-Ohio Valley. We offer all the comprehensive care here in Belpre at our own cancer center. And we want patients to be able to go home to their families at night and lay down in their own beds and sleep at night and not have to travel to these large tertiary centers that require them to be away from the people that they love the most throughout this journey.
I know donor support is so critical, especially for our cancer patients that are often on long journeys and need support. You have tremendous social workers as part of the cancer center.
The backbone of our cancer center, honestly.
They are. We work with them a lot in the foundation. But let's talk a little bit about the importance of that. How you see that donations are helping our patients.
So they're, specifically focused on cancer patients. We have the Patient Emergency Initiative, and that fund is used to help patients throughout their cancer journey, just assist them with their maintaining their quality of life. So, as you can imagine, sometimes a cancer diagnosis means they may be out of work and different financial strains that are difficult for them to overcome without some sort of assistance, just to help the patient in any way in that manner. And it is often used for transportation. Luckily, we serve a large region, and we have patients coming from multiple counties around Washington County. And we do use that fund abundantly to assist those patients to and from treatment. Even something as small as trying to help them with, a utility bill for a brief time to make sure that they have heat in their home or water coming into their home, because all of that affects their quality outcomes and really how successful they are in their cancer treatment. And even outside of monetary donations, if there's anyone in the community that is unable to help in that way, we welcome any kind of volunteer support that we can get. And especially we have our volunteer driver program that we are currently recruiting drivers to also assist in transportation as well.
As we finish here, one thing that is a huge advancement to our entire health system has been our connection with the Mayo Clinic.
Yes.
I know the Cancer Center uses the Mayo Clinic. Can you talk a little bit about what that experience is like for both our providers and the patient?
Yes, we have a unique relationship with Mayo that gives our patients and our providers access to those Mayo providers that can support our providers as well as our patients in helping them make difficult treatment decisions for patients. It's a free of service to our patients, and it's all done electronically so that the patient does not have to travel to Mayo. And patients are so thankful to get that second opinion and to have that security of knowing that they are getting an expert opinion without having to leave their homes.
Stacey, this has been exciting to talk about the Cancer Center and to revisit some of the special things that make, the hope and the healing that we experience here and our community experiences here. I know it's a special place for so many. We have great providers that are talked about frequently with great passion from our patients. And so I know for you, it has to be a very special place to work as part of the health system.
Yes, it is my pleasure to be here and tell you about all of the services that we have.
Once again, thank you so much to Stacey and our Cancer Center team for having us and for sharing the important work they're doing every day to ensure our patients have the best experience during their care journey with us. And to our viewers, thank you for spending time with us and for your continued support of Memorial Health Foundation. Your generosity fuels progress, expands access to care, and strengthens our entire health system, from Marietta to Sistersville to Athens and beyond. Keep an eye on your inbox for the next edition of Caring Unveiled, where we'll continue to share inspiring stories and meaningful updates. If there's something you would like us to feature in a future program, I'd love to hear from you. Don't hesitate to reach out. Until next time, thank you for being a vital part of our mission. Take care, and we look forward to connecting again soon.